Baking powder is a common leavening agent used in baking to help baked goods rise and become light and fluffy. It typically contains a combination of three key ingredients: an acid, a base, and a filler or stabilizer. The most common type of baking powder used in households is double-acting baking powder, which means it releases gas both when mixed with wet ingredients and when exposed to heat during baking. Here are the typical ingredients found in baking powder. 1. Baking soda, sodium bicarbonate. Baking soda is the base in baking powder. It reacts with the acid component to produce carbon dioxide gas when mixed with liquid, which helps to leaven the dough or batter. Baking soda is generally considered safe in moderate amounts when used in recipes. 2. Acidic component. Baking powder contains an acid, often in the form of cream of tartar, potassium bitartrate, or sodium aluminum sulfate. The acid component reacts with baking soda to create carbon dioxide gas. Cream of tartar is a natural byproduct of winemaking and is generally safe when used in baking. Sodium aluminum sulfate is another acid used in some baking powders, but it has been associated with concerns about aluminum intake in large quantities. 3. Filler or stabilizer. Baking powder may contain a filler, such as cornstarch or rice starch, to prevent clumping and maintain the powder's stability. Cornstarch is a common choice and is generally considered safe for consumption. Health pros of baking powder. 1. Leavening agent. Baking powder helps baked goods rise, creating a light and fluffy texture in items like cakes, muffins, and pancakes. 2. Low in calories. Baking powder is calorie-free, which can be beneficial for those who are calorie conscious. Cons of baking powder. 1. Sodium content. Baking powder contains sodium, primarily from baking soda. Excessive sodium intake can contribute to high blood pressure and other health issues. However, the amount of baking powder used in most recipes is relatively small, so it usually doesn't contribute significantly to sodium intake. 2. Aluminum concerns. Some baking powders contain sodium aluminum sulfate as an acidifying agent. There have been concerns about the potential link between aluminum intake and certain health conditions like Alzheimer's disease. However, the aluminum content in baking powder is typically low and unlikely to be a significant source of aluminum exposure in the diet. In summary, baking powder is a common ingredient used in baking to leaven baked goods. It generally contains safe ingredients, but individuals with specific dietary concerns, such as sodium intake or aluminum exposure, should be mindful of their consumption. As with most ingredients, moderation is key, and using baking powder in typical recipes is unlikely to pose health risks for the average person.